Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Lintzman. And my guest on the podcast today is Jocelyn Moran. Jocelyn is a lab assistant here at CCMH. And Jocelyn, thank you for joining me today.
Hello, how are you?
I'm great, thank you. We're going to talk about phlebotomy because it's kind of a big deal in February. We have a phlebotomist recognition week. It's by for a little while, but I think one of the reasons why I wanted to have you on the show today is because I really want to talk about blood draws. There are a lot of people who have issues with that. Sometimes it's because they don't get it done very often, so they're scared of it, or they don't understand why it's done or how it's done, and we're going to explore all those questions today. But before we start with that, Jocelyn, first of all, tell us a little bit about yourself.
Well, I've been a lab assistant for about 5 years now, and I'm currently in school to move on to be an MLT.
And MLT stands for?
Medical Lab Technician.
Which is a step up from lab assistant.
Yes.
Yeah, so we're moving up the ladder, and we're glad you are. Actually, people may not know this, but MLTs, or medical lab technicians, are not easy to come by. They do not grow on trees.
No, they do not.
They do not, and we've had to go far and wide to recruit people to come work for us. In fact, we've had to go overseas to get that done. So it's nice to have somebody locally who's going to go ahead and become an MLT for us. So the first question I think most people would have when it comes to blood draws is, what are the different types of blood collection methods that you use in phlebotomy? And just so people understand, phlebotomy is just drawing blood, right?
Yes.
I mean, it's a pretty simple definition. Phlebotomy is like a big, difficult word to spell, and sometimes it's not all that easy to pronounce either. But we're just talking about blood draws. So what are the typical blood collection methods that you use?
Well, the most common way that people are very familiar with would be a venipuncture. This is just drawing blood from the inside of the arm. For infants, we usually draw from the heel, but there are also different sites that I can draw from.
And partially that has to do with when you draw from a different site, other than inside the arm, it probably has to do either with age, like with an infant where you're drawing from the heel, or potentially from infirmity, where you have some people who are perhaps older and their veins are difficult to find, and you have to draw from the back of the hand or some other place.
Correct, yes.
Yeah. So what about the most common sites? You talk about drawing blood when we have a patient who comes to the lab. What's the most common place that you use in order to be able to draw blood?
I usually go for the inside of the arm. Right when you're looking at the inside of the arm, there's about 3 main veins there, so I usually just try to go for the center vein and move from there if I can't find one. Typically I'll have to draw from the top of the hand, again, like you mentioned before, if they have rolling veins or just even small veins, or the older people that come in as well. Usually it's difficult to draw from the inside of their arms.
Yeah, and I think people have to understand that when you talk about the inside of the arm, you're talking about the elbow region, correct?
Yes, yes.
Yeah, because that's maybe the easiest place to go ahead and access one of those veins. And as a guy who's got rolling veins, I certainly can understand why it's sometimes difficult to stab those things, although we never use the word stab in phlebotomy, do we?
No, never.
My guest on the podcast today is Jocelyn Moran. Jocelyn is a lab assistant here at CCMH. She draws a lot of blood, so we're talking about phlebotomy because I think it's important, and we do a lot of that here. So how do we, Jocelyn, when you're working with a patient, how do we ensure their safety and comfort while we're doing blood draws?
Well, the first thing that I do with all of my patients, I verify my patient. I ask them first and last name, date of birth, make sure they're able to repeat that back to me. And then I make sure that they are comfortable before I even get my tools out to draw. If they need talking through, I'll explain what I'm doing for my procedure, and then I'll go ahead and get started.
And I think a big thing about it is just getting people comfortable. Would you agree with that?
Yeah, sometimes I have a lot of anxious people, so usually just talking to them just about everyday life sometimes just helps them calm them down a little.
And maybe take their mind off of what it is you're actually working on. Yeah. I have done this blood draw thing, and we've got our wellness event coming up in about a month at the end of March, and we see 360 patients over 2 days when we get to the end of March. And I think most patients, when they come for a blood draw, notice that you use more than one tube when you draw it. And there's a reason for that. So let's talk about why we use different tubes for blood draws and why one tube usually isn't enough, that we usually have to take at least two.
Right. So usually when I am drawing a patient, they'll usually see our four main tubes. We'll have a red tube, a green tube, a blue tube, and a purple. The red tube is usually used for chemistries or drug levels. The green one is used for chemistry tests, such as like maybe checking your electrolyte, sugar, potassium level. Blue and purple both have clotting agents in them to prevent the clots. So the blue one has a coagulant and the purple has a substance called EDTA to prevent that from clotting when doing blood counts.
And I guess probably a little bit off script here, understanding that we have a whole room full of devices in the back, and most of this, while we test any number of different kinds of bodily fluids, more often than not, blood is what we're working on. It's the most prevalent test that we take. But there are a lot of different tests that we can run on blood, and you named a few of them, electrolytes, and different kinds of things. So if people question you about the number of tubes, you're able to answer that question and say, here's what we're using all of that stuff for.
Yes, usually one tube is not enough. Even just as simple as doing a metabolic panel and a CBC, that there requires just two tubes for two different tests that have a lot of different components to them.
And CBC stands for?
Complete blood count.
Oh, complete blood count. I thought it was something else. Oh, sorry.
No.
Okay. Good. Complete blood count. All right. Very good. My guest on the podcast today is Jocelyn Moran. Jocelyn is a lab assistant here at CCMH. We're talking about phlebotomy and blood draws because that's an important part of patient care. Probably the biggest reason that we draw blood from patients is because of the information that we get for diagnosis and potential treatment for medical conditions. And let's talk about, let's talk about that aspect of it, because this is the part of the blood draws that fascinates me once we're done with all the testing.
What do you mean by that?
Well, so let's take, for instance, diagnosis. So when you get the results back from a blood test, you can tell lots of different things about people. And you already talked about blood sugars and so on and so forth.
Yeah, so one of the things that I think is easiest for people to understand is with the CBC, complete blood count, is off of that, looking into diagnosis. If someone has a low red blood count, usually that can help distinguish if someone has anemia. Or if they have a low hemoglobin, they are lacking blood in their body.
And sometimes, and more often than not, we find out, primarily through a blood test, what their potential issues might end up being.
Correct, yes.
And I think that that's the most, what I understand about this is 90% of all diagnoses are made because of results that come back from blood tests. 90%.
Yes, I like to tell everyone that the lab is the heart of the hospital, because without us, you can't really do much.
and it's hard to imagine what medicine would have been like before we had not just the technology to be able to draw the blood, but to test it later. Because I think, what would you have done if you couldn't test the blood to figure out what's going on there? Because again, 90% of diagnoses come from that. Treatment follows on from diagnosis. Hard to imagine what healthcare would look like if we didn't have the ability not just to draw the blood, but to test it to see exactly what was going on. I think it's fascinating. You must see this all the time every day.
Yes. Only 5 days a week here.
Only 5. Okay, very good. Well, to finish up today, Jocelyn, I know one of the things that ends up happening, though, is that people come in for blood draws, and it can cause a great deal of anxiety in patients. How do you deal with patients who struggle with the concept of even just the thought of having their blood drawn?
I think the best way is honestly just to talk to them about random things. My favorite is just to ask them about the weather or if they have any busy plans today. The hardest would be with kids, so sometimes I have to talk to them about their favorite show that they're hooked on, cartoons. Sometimes I like to give them little treats and stickers, and sometimes it works with the adults too, so easy work.
No, I was going to ask you if many of your patients cry, and I would have said, yeah, if you'd have said yes, I'd say, well, how many of those are children? Because my guess is it's mostly adults. Well, there is a fair amount of anxiety. For people who are getting ready to come in to get their blood drawn, what would you suggest that they do in preparation for that?
I think being well hydrated, it makes it easier for us to find veins, and if we're able to locate the veins, the process is a lot quicker than having to search for them or even having to do multiple sticks sometimes.
And wouldn't you say that that's the biggest problem most of the time? People are not fully hydrated. When we talk about being unable to find a vein in an arm or having to go to the back of the hand, a lot of times it's because people have not had enough water to drink.
Correct. Staying hydrated is probably the number one key here.
Yeah. Anything else that you want to share today about your experiences, or one thing maybe that you would tell people, look, if you're going to come in to get your blood drawn today, like don't cry, but and drink water. Is there anything else beyond that?
I think you just hit it there, Don. I think staying hydrated, checking that we have your lab orders to make it quick and easy for everyone. I mean, that's all I got, really.
Yeah, lab orders are a big part of that. We have more than, so you draw blood, but we have a bunch of other people who do that as well. So people might see you when they come in for their blood draw, but they might see someone else.
Yes, I think I have about 7 or 8 other friends in the lab that are willing to give you a little poke.
Yeah, and they're all, I think they're very, very talented people. I get an opportunity to see most of the comments that come back from patients, and they're extremely appreciative that it didn't hurt. Because if there's one thing I think that people are afraid of with the blood draw is that it's going to hurt. But so they're going to stick a needle in your arm, right? So
yeah, as long as the alcohol wipe is dry, it should be pretty painless.
Well, we're gonna hold you to that.
Yeah.
Well, I appreciate your time today. Thank you very much.
Thank you for having me today.
My guest on the podcast today is Jocelyn Moran. Jocelyn is a lab assistant here at CCMH. We're talking about phlebotomy, about blood draws, because February contains National Phlebotomy Week, and we want to make sure that we honor our phlebotomists, all the people here who, as Jocelyn pointed out, very much the heartbeat of the entire organization, because this is where we start to help people get well. I'm Don Litzman, your host for the Here's to Your Health podcast. Thanks for listening today. Have a great day.